Good day, sir. I am Justin and I am your nurse for today. So today, the procedure that we are gonna do is a simple health history taking and a head-to-toe assessment. Rest assured that the information conducted will be kept private and confidential. So sir, do you have any question?
None.
If none, we provide there an examination gown for you to be comfortable. While the patient is changing into an examination gown, provide client privacy by providing partitions, wash your hands, and gather all the equipments. So the equipments needed are the clean gloves, the BP apparatus, the stethoscope, the thermometer, the Snellen chart, the tuning fork, the pen light, the otoscope and ophthalmoscope, and the 3 cents and the 3 taste. The tongue blade, ruler or tape measure, then pen, cotton, the keys, clip, and the reflex hammer. Now, the patient is ready, so the overall appearance of the patient is clean and well-groomed and dressed appropriately to the weather. So, next is to get the vital signs of the patient such as the temperature, the blood pressure, the respiratory rate, the pulse rate, and the pain using the pain scale. Also get the waist, hip, and mid-arm circumference and the tricep skin fold thickness for calculating the BMI and other anthropometric measurements. So sir, can I see a happy face, a sad face, an angry face? So the patient can express facial expressions clearly, maintains and makes eye contact, and can follow verbal commands and able to focus on the given task. So sir, who is the President of the Philippines today?
President Rodrigo Duterte.
Who is the national hero?
Jose Rizal.
What day is it today, sir?
Sunday,
What date?
May 17, 2020.
So sir, do you have any idea where you are right now?
I'm inside the clinic.
So the patient is oriented to place, time, and person. So sir, what does the quotation prevention is better than cure means to you?
I think it is very practical because it hinders the damage that will happen.
Okay, sir. So I will give you a scenario. Assuming that you are walking on the street and
There's a
suddenly...
motorcycle. Oh, there's not. Okay, go.
No. Assuming that you are walking on the street and then suddenly a dog barks at you and tries to hurt you. So what would you do?
I think I will avoid.
So the patient conveys feelings and ideas with appropriate words and expected reaction on the given scenario. So sir, what did you eat for breakfast today?
Corn.
What mode of transportation did you use?
Due to ECQ, I walk.
Sir, when was your last hospitalization? None?
None.
Okay. So the short-term memory of the patient is intact and the patient has no record of any hospitalization. So sir, let's proceed to the skin assessment. Okay. So the patient's skin is moist and warm to touch. The turgor is intact on the clavicular area, and the general appearance, there are no lesions, no edema, and no swelling on the exposed part of the body. Sir, can you open and close our mouth? Okay, sir. So, can you smile? Can you frown? Can you puff your cheeks? Can you show me your teeth? Can you put out your tongue? Okay, sir. So, the next procedure is you need to close your eyes and identify which side of your face feel the pressure. Okay, sir.
My left part. My right part. My upper right part. My upper left part. Both sides.
Okay. The head of the patient is round, smooth, and hard without lesion. The hair is smooth and black upon touching and no lesion flaking upon palpation. The face is symmetric, smooth, and without lesion, as well as the facial structures. And upon palpation of facial structures, the cranial nerve number 7 and 5 are intact. The bilateral arteries are smooth and elastic. The temporomandibular joints are non-tender and no cracking. So sir, let's proceed to the eye assessment. Can you see the Snellen chart?
Yes.
Can you read the 8th line?
DEFPOPEC.
How about the 9th line?
LEFODPCT.
Okay sir, so I will put my finger in front of you and just stare at it, and I'm going to move my finger on specific place or specific location, then tell me if you can see it clearly. Okay?
Yes. Yes.
Okay sir. Next sir, I'm going to put this on your eye to test the corneal reflex of your eye. Okay, sir. The visual acuity of the patient is 20/20 based on the Snellen chart that we use. The visual fields is full of confrontation and corneal reflex is evident upon assessment. The extraocular movement of the eyeballs are smooth and intact without ptosis noted. So the external structure of the eye, the eyebrows are thick, black, and well distributed. There is no redness and discharge on the lid margin of the eyelid. Sir, can you close your eyes? Can you open? So the eyelid can close and open smoothly. The eyelashes are thick, black, even distributed. The conjunctiva is warm to touch, moist. The sclera is white and the iris is dark. Okay, next sir, I'm going to assess the internal structure of your eye. So first, I'm going to dim the light.
Okay.
Okay sir, just look forward. Upon assessment of the light corneal reflex, it is present and evident. The pupils are equally round and reactive to light accommodation. The pupils reacts quickly and constricts up to 3 millimeters. The iris is black, and by fundoscopic examination, the red reflex is bilaterally evident. So sir, let's proceed to the ears assessment.
Okay.
Okay. Okay, the external structure of the ears of the patient is symmetric. Bilaterally, the auricles are without deformity, lesions, and lumps. The mastoid process are non-tender. The auditory canals contain small amount of cerumen, and the tympanic membranes are pearly gray and transparent without bulging and retraction. And bony prominence on the tympanic membranes are visible bilaterally. So sir, I'm going to stand here and close your eyes and identify what would I say. Hello, hello.
Hello, hello.
Just close your eyes, sir. Hello, hello.
Hello, hello.
Okay, sir. For the next test, sir, I'm going to put this on your head and tell me if you can feel the vibration on your both ears.
Yes, I can feel it.
Okay, sir, for the next, tell me if you can still feel the vibration, because if you cannot feel the vibration anymore, I'm going to change it to test the air conduction.
None. Yes. None.
Okay.
None. None.
Okay. The patient can distinguish two-syllable words at 3 feet distance, and based on the Weber's test, there is equal lateralization of sound on both ears, and based on the Rhine's test, the air conduction is greater than the bone conduction. So, sir, let's proceed to the nose assessment. So, first, I'm going to assess your nose. Okay. So, sir, can you look up? I'm going to check the internal structure of your nose. Okay, sir. The nose are symmetric and without deformity and inflammation. The turbinates in the middle meatus are pale pink without swollen. The nasal septum is midline without bleeding, perforation, and deviation. So, sir, next we will assess the patency of airflow and the smell sensation of your nose. So, sir, I'm going to occlude one nostrils and tell me if you have still good flow, a good airflow. Okay, sir. Okay. Okay. Other one. Okay. So, sir, I have here the 3 sensor, and you're going to close your eyes and try to identify what sense it is. Okay.
Alcohol.
Okay.
Perfume.
Okay.
Vanilla.
Another one, sir.
Perfume.
Okay.
Alcohol. Vanilla.
Okay, sir. You can now open your eyes. So the patient was able to identify the smell of perfume, vanilla, and alcohol, meaning the cranial nerve number 1 is intact, and also upon the palpation of the sinuses, the frontal and the maxillary sinuses are non-tender. Let's proceed to the mouth and throat assessment, sir.
Okay.
So, wait, sir. I'm going to put my gloves. So, sir, can you look at me? So, the patient has special hair around around the oral mucosa, and the lips are pink, smooth, and moist, without lesions. Sir, can you stick out your tongue? Can you stick out? Can you say ah? And then. Okay, so sir, I'm going to put pressure on the sides of your tongue and try to resist it. Okay, on the other side. Okay, so sir, Close your eyes, and I have here my 3 tastes for you to taste, to identify the taste and to test the taste sensation. So for the first taste, stick out your tongue, sir. Stick out your tongue, sir. Close your eyes, sir.
Sweet.
Sweet. Okay.
So,
Next.
Salty.
Okay. Next is, okay.
Sour.
Okay, you can now open your eyes, sir. Then, so the tongue is midline and well protruded. The buccal mucosa are pink and moist. There are no ulcerations noted. The gums are pink. The gums are pink and moist without inflammations and bleeding. The hard and soft palate are evident without lesion. The uvula is midline. The tonsils are without oxidates and enlargements. The gag reflex, which indicates the cranial nerve number 10, are intact. Also, the cranial nerve number 9 are intact because the patient can resist the pressure on the tongue, on his tongue, and can taste different taste. Now let's proceed to the neck assessment. Okay. Sir, can you chin up? Can you face down? Look to the right. Look to the left. Can you rotate your head counterclockwise and clockwise? Okay, sir. Can you swallow your saliva? Okay, sir. So the neck is symmetric without bulging, swelling. Upon assessment of posterior aspect of the neck, the C7 is visible, full and control. ROM, particularly the cervical region, is noted without limitations. The thyroid gland is non-tender. The trachea is midline. There is no difficulty in swallowing. The lymph nodes are not inflamed. The carotid arteries are positive to pulse without carotid bruits. So, sir, let's proceed to the posterior chest assessment. So, sir, can you turn back, and I'm going to remove the gown on your back. Okay, sir. So, upon inspection, the patient has brown complexion, which is consistent to his overall skin condition. It is warm to touch, moist. There are no bulging, lesions, tenderness, the tenderness, and then, okay. Sir, can you say 99?
99. 99. 99. 99.
Okay. So it is evident that the scapulas are symmetrical and the spine is in midline. The fremitus is evident. So, sir, I'm going to percuss. Okay, sir. Take a deep breath. Deep breath. And then exhale. Okay. Okay, sir. Take a deep breath again. Exhale. Okay. So sir, for this time, take a deep breath, and then hold, and release. Okay. So sir, I'm going to auscultate. Inhale, exhale, 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 inhale, exhale. Okay. So the respiration is even and regular. There is no use of accessory muscles. The spine is aligned posteriorly, and then the thorax expands symmetrically without retractions. The bilateral tactile the bilateral tactile fremitus. There is bilateral tactile fremitus. Upon percussion, it is resonant. It has diaphragmatic excursion using the pen and the tape measure, and it is equal bilaterally. And then the vesicular sound is heard on all fields of the lung, and the bronchovesicular is heard on the sternal area, and then the bronchial sound is heard on the scapula area, and then there is no adventitious sounds. The heart is regular, has regular rhythm. So sir, let's proceed to the anterior chest assessment. So in this assessment, you need to remove the gown. So sir, inhale, exhale, inhale, exhale, inhale, exhale. Okay.
Mas mura ba yun? Mas mahal? Tapos 25 kasi yung 5 lang.
So the anterior superior diameter to lateral ratio is 2:1, and then the slope of the rib on the angle of Louis is 40 degrees, and then the skin color is brown. The skin color is brown without lesions and swelling, and then the respirations are even and regular, no use of accessory muscles, no nasal flaring during the respirations, the thorax expands symmetrically and expand symmetrically without retractions, and then there is no bilateral tactile fremitus. There is bilateral tactile fremitus, and then upon percussion, it is resonant. The vesicular sound heard on the lung fields, the bronchovesicular sound heard on the sternal area or sternal borders, and then the bronchial sounds noted or heard on the clavicular on the clavicles. And then there is no adventitious sounds. There is presence of mobility and turgor, and the apical pulse are palpable. The heart rate is regular, and also the rhythm is regular. So there is evidence of S1 and S2 sounds. There is no S3 and S4 sounds. So sir, let's proceed to the abdomen assessment. So sir, can you lie down? So sir, I'm just going to percuss. So next sir, I'm going to apply a light pressure. So sir, I'm going to apply more pressure. Okay. Um, so the abdomen is, as you can see, the abdomen is round, round and symmetric, without lesions, without bruise. There is no varicose veins. The umbilical area is midline, and then without swelling or any discoloration. And then the bowel sounds are present and active. The gurgling sound. So let's proceed to the lower extremities assessment. Okay. Sir, before you sit down, can you perform the heel to shin test? Okay. Okay, now you can sit down. And I'm going to assess the reflex. The other one. Okay. Okay, sir. Can you swing your lower extremities? Okay. So, sir, I'm going to put pressure and determine where is the location. It is left or right.
Right.
Close your eyes, sir.
Right. Left. Right. Left. Both sides.
Right, sir, I'm going to put pressure on your toes and determine which side of your lower extremities is it.
Right part. Left. Both sides.
Okay, sir, you can now open your eyes. So the lower extremities symmetric in size and shape. The skin is brown, intact and warm to touch, and without lesions, without swelling, and without bulging, bruising, and without varicose veins. The femoral, the dorsalis pedis, the popliteal, the posterior the posterior tibial is positive to pulse without tenderness. The capillary refill is 2 seconds. The muscle tone is intact without atrophy. The muscle strength is 5/5. Then the patellar and the Achilles reflex are evident, and the patient can perform heel to shin without difficulty. So that's the superficial, light and deep sensations are intact, and then the position senses of the toes are evident. So now let's assess the musculoskeletal and the neurological system. Sir, can you stand up? Okay. Sir, can you look on your left and then bend? Okay, you can now stand up. So the posture is erect and no spinal deformities. So next, sir, can you walk 5 steps on your left? 1, 2, 3, 4, 5, and then back here. 1, 2, 3, 4, 5. The gait is steady, smooth and coordinated, and there is smooth ROM on the upper extremities and the lower extremities. So sir, can you do the tandem walk like this? 1, 2, 3, 4, 5, and then back here. 1, 2, 3, 4, 5. So the patient can perform the tandem walk without difficulty, and the patient has good balance. And then next, sir, can you hop using your one leg on your left part? Okay, hop, Then on the other side, hop, hop. So the patient can hop with one leg without difficulty. So next, sir, we're going to do the Romberg's test. Stand up erect and then close your feet. Then close your eyes and then I'm going to count 1 to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So the patient has negative on the Romberg's test, although he is a little bit shaky, but it is considered as negative on the Romberg's test. So last, sir, can you sit down and do the nose to finger test like this. Okay, then do it as fast as you can. And the other hand. Okay? Okay, sir. So the patient can perform the nose to finger test without difficulty. So that's all. And then before ending the head to toe assessment, wash your hands, perform hand hygiene, and then document all the data that you conducted, and then make a referral if there's some abnormalities that you conducted.